Thank you so much, Dr. James Peacock, for joining us today in a very relevant and important conversation about Ebola virus.
Happy to be here today and talk about a topic which obviously has generated a lot of interest.
So, just to go straight into the matter, what is Ebola virus and why are we hearing about it at this time, and why should anyone learn about it?
Ebola, as is stated in its name, is a virus, so unlike other germs, it's a virus, not a bacterium. It's a virus which has been recognized and known to exist for a number of years, but only recently coming to the consciousness of the public because of the events that are occurring now in Africa. It was actually first isolated or identified in 1976 in what is now the Democratic Republic of the Congo along the Ebola River, thus its name. And since that time, there have been 5 total variants of the virus identified, one of which is the Zaire strain of Ebola, which is the one which is now causing problems in West Africa. There are other strains as well. Of the other 4 strains, 3 have been shown to cause human disease and to be associated with outbreaks. One, the Reston strain, which was identified in the United States from monkeys imported from the Philippines, has not been demonstrated to cause human disease, although it can cause asymptomatic infection. But again, the viruses have been around since 1976. They originally were associated with large outbreaks of disease in Central Africa, and more recently have been recognized in West Africa, where the current outbreak is occurring.
Mm-hmm. And where does this virus, I'm sure it doesn't live within civilization. Where do you find this virus? Where did it come from?
Like many infecting agents, there is presumed to be a reservoir in the environment somewhere, either in an animal reservoir or another site. And based on current understanding, and that understanding is incomplete, it's thought that Ebola probably has as its primary host an African fruit bat. And from the African fruit bat, it is then transmitted potentially to other animals in the environment, including non-human primates like chimpanzees, monkeys, gorillas, and then perhaps other animals such as antelopes or porcupines. And humans then potentially come in contact with the virus as they contact those animals, often in the context of hunting and using them for food sources.
So the way humans get infection is from, maybe this whole epidemic was initially through the fruit bats or contact with the other.
I mean, it is thought that the food pathway is probably the mechanism whereby humans contact the virus, that a human will kill an infected animal, and then through the process of preparing that for food in contact with blood or body fluids, or in terms of it consuming or eating the animal, that the virus is then transmitted to humans.
And how do humans acquire infections? By each other? Like, how does?
Well, once you have infection transmitted to humans, that human then becomes a potential source or reservoir for further transmission of infection to other humans. The more closely humans live together and reside together, the greater the likelihood of spread. So it might be less common in remote rural areas, small villages with few people, but once it gains access to urban centers, as it now has, the risk for transmission might be much greater. In terms of the person-to-person spread that occurs, it typically would require fairly direct contact from an uninfected person contacting an infected person. Now, that infected person, it has been shown that the virus may be present in a number of bodily secretions like saliva, like tears. It's present in excretions, such as if persons are vomiting or if they're having diarrhea. It's also present in other bodily fluids, including blood, and contact with those excretions, secretions, fluids, or blood may lead to transmission to other humans who are uninfected. In general, that transmission would require contact with one of those fluids or bloods with a mucous membrane surface, the eyes, the mouth, the genital membranes, or direct inoculation into the tissues or to the bloodstream.
And also it can stay on the surface for quite some time, and it can be transmitted through as vomiters. So once the person is infected, what does the virus do to the body? What happens next?
As the virus enters the body via one of the mechanisms we talked about, it's either picked up by the lymph which is the tissue fluid which bathes the tissues, which then enters the bloodstream, or if inoculated directly into the bloodstream, it'll travel via the bloodstream, and it goes to multiple cells and tissues throughout the body, including cells within the bloodstream, cells which line the blood vessels, cells in various organs, particularly the liver and the kidneys, and some glands near the kidney called the adrenal glands. And once it goes to those sites, it invades the cells at those sites and begins to grow inside those cells, and by so growing actually damages those cells, will kill them, that will injure the organs and ultimately lead to severe damage or failure of those organs.
So now the virus has come from fruit bat to one human being and then other human beings, and it enters the body through the bodily fluids, enters the body, enters the blood, and goes into multiple organs, almost any organ it can see to. And when does a person show the symptoms that the virus is in their body indeed now?
Again, that kind of relates to the question of an incubation period. How long does it take from the time the virus is introduced to the time that it may cause disease? And for Ebola, it's been suggested that the incubation period may be as short as 2 days, and that may occur in persons who receive an exposure to a larger number of the viruses or have a larger number introduced in their body, particularly directly into the bloodstream through an injection, or it may be as long as 21 days, but it's felt that most people that acquire infection will manifest symptoms or signs of that infection by 21 days, and if they've not shown symptoms or signs by 21 days, they probably did not become infected.
Okay, so 21 days is sort of what we know for now.
Right, it's the outer limit of the incubation phase.
So if you haven't exhibited symptoms in 21 days, then maybe you're not infected.
That would be the current thinking.
And now that the virus has entered the body and patients start to exhibit symptoms, how long that person can transmit the virus to another person or another human being, as we call it, being infectious, how long the patient is potentially infectious?
Again, obviously in the context of a big outbreak, that becomes important in terms of an individual person, how long might they potentially be able to transmit it to another person. And it's certainly thought that the onset of infectivity or the ability to infect others occurs at the time symptoms began, so most typically fever. So with the onset of fever, it is viewed that patients thereafter are infectious. Their period of infectivity lasts throughout the time that they're clinically ill, throughout the time they have fever and other symptoms, and it's thought that when symptoms completely resolve and patients enter a phase of recovery, that they probably have limited ability thereafter to transmit the virus to others. Now, there have been some studies done looking at various tissues, and for example, in males, looking at some of the sexual secretions, particularly semen, it's been shown that the virus may be able to persist in that for several weeks to even several months.
Several months.
It is possible that that might serve as a slowly cleared reservoir that could lead to transmission even after the acute illness resolves. So as a consequence, one of the recommendations is that if a person has been infected, they don't have any sexual activity for about 3 months after the infection.
Oh, so if the patient is infected, even after they have recovered from the acute phase, up to 3 months, they should refrain from any sexual activity to avoid transmission via that route.
And again, that is a currently recommended practice. It's based on some animal studies, but whether that applies to humans, not absolutely certain, but again, better to be safe than sorry.
Exactly. And what are the main symptoms and signs that we associate with Ebola virus infection?
In terms of the clinical syndrome, it's unfortunately relatively nonspecific in the sense that it looks like many other viral illnesses, so there's nothing specific that would say, I am Ebola. The things that typically occur with it are fever as a common marker of infection. Patients generally ache all over, muscles and joints can be very, very painful. They typically have nausea and vomiting, often have diarrhea, frequently have pretty severe abdominal pain. And then as the illness progresses, they may develop hemorrhagic or bleeding complications. One of the earlier names for this syndrome was Ebola hemorrhagic fever, implying that hemorrhage or bleeding was a part of it, and bleeding may occur spontaneously from mucous membranes, so from the mouth or through the nose or in the GI tract, passing blood out in through the stool.
This is, other than that, the bleeding complication, the initial presentation does look like very non-specific.
Yeah, unfortunately, it is very non-specific.
Which causes challenge in diagnosing patients.
It makes the diagnosis very difficult, and then you're left with relying upon other clues, and in particular, one of the most important would be exposure to other ill persons with similar illnesses, particularly a person that was known to have had Ebola, residence in and travel from one of the countries where outbreaks are occurring. Right now, that's pretty much limited to 3 countries in West Africa: Liberia, Guinea, and Sierra Leone. So any person that has been in one of those locales and then travels to other places that then develops symptoms, that would be a key to think about Ebola.
Okay. And so somebody who is traveling in those sites and comes and to the ER, gets diagnosed, comes with the symptoms, and the physician is suspecting this patient could have Ebola virus. How does the physician proceed further, or what the patient should know about the diagnostic labs available at this time?
I think it probably important to emphasize that in the early phases of evaluation, when that question arises, that the diagnosis is based purely upon epidemiology. That is, have you had contact with a potentially infected person? Have you been to a country where outbreaks are now occurring? And then the clinical syndrome, which we've already mentioned, is non-specific, but if the epidemiology and the clinical syndrome are together, then a presumptive clinical diagnosis should be made and you should proceed accordingly.